Have you ever wondered, have you ever imagined a situation, a healthcare situation where people don't needlessly die as a result of preventable causes, preventable diseases? Have any of us imagined that before? Have you ever thought that is possible? Okay. This is the reality of the Nigerian healthcare situation today. You see, many Nigerians die from diseases that they ordinarily shouldn't have died from. You see situations whereby there are high rates of maternal mortality, that's death as a result of childbirth. These are on the large scale preventable. You see children who die, newborn babies dying shortly after birth due to reasons that are very preventable. These are our current realities in the healthcare situation, but it could be reduced to a large extent, or if possible, eradicated totally. My name is Dr. Nzerem Justice Onyedikachi. I'm an advocate of preventive healthcare. I'm a consultant pediatric optometrist with the Leadway Eye Clinics Abuja. Today, I will want to take us on a journey to unravel how this could be possible in Nigeria. So, I'll be speaking on the topic better safe than sick, why Nigerians should embrace preventive healthcare. And what is preventive healthcare? Now, preventive healthcare in layman's terms means putting measures in place to prevent disease, to prevent death, and to prevent disability. So, what are these measures we're going to put? We will necessarily put in place. These measures are measures like immunization and vaccination to prevent diseases, providing adequate healthcare facilities so that it will be accessible to people, and also creating awareness among the stakeholders so that we can be intentional about making this a reality. And when these are implemented to the letter, it has been proven beyond reasonable doubt that in all the places where it had been applied, it had reduced the rate of avoidable deaths to a large extent. I'm going to, if time permits us, to run us through the obvious benefits that had accrued, that had come up when these measures are being put in place. The first one is that when these measures are being put in place, now it has been proven that it reduces the cost of treatment by a large extent, and also in the long run reduces the cost of death. What do I mean by this? Now, there's a study that was conducted in Nigeria specifically on the treatment of malaria by the WHO in 2020. They found out that in the treatment of malaria alone, Nigeria spends as much as 450 billion naira. Now, when you put it into perspective, malaria is one of the most avoidable diseases that is endemic in Nigeria. It means that if this is applied appropriately, Nigeria should be saving a whole lot of money from the treatment. That's if prevention is applied. Now, they went further in the study to recommend that it's practicable in other climes like in India, that for every 1 naira that is being spent on prevention, that the system is saving 10 naira, meaning that the saving coming from prevention is exponential when it's being put into place. Now, the second lesson from other countries is that when preventive healthcare is actually put in place properly, it reduces the costs, it reduces the rate of avoidable deaths due to what we call lifestyle diseases. Now, what are lifestyle diseases? Lifestyle diseases are diseases, in simple terms, we call them non-communicable diseases. They are diseases that will happen not necessarily due to exposure to other causative agents. Diseases like hypertension, diabetes, cancers, most times they're as a result of, it might be as a result of your lifestyle or without your lifestyle, but they eventually happen, nevertheless. Now, what preventive healthcare does when you put into place is that diseases like hypertension, most times when people are hypertensive, you see that they report to the clinics without being aware that they are hypertensive because they don't have understanding of what the symptoms of hypertension should be like. Now, what preventive healthcare system does is that when it's put in place, it actually picks it up at the early stage and guides both the patient and the practitioner on the cost of a proper management, thereby reducing the cost of avoidable death from these diseases. Now, there's a study in Nigeria also from the International Healthcare Evaluation Agency in 2023. So they realized that of all deaths in Nigeria, that 29% of those deaths are as a result of preventable causes. Now, it means that if this large number could be responsible for preventable causes, it means that if we implement appropriate preventive healthcare mechanisms, we are going to be reducing the amount of death we have in the system to a reasonable extent. Now, the third and the final is that if these measures are being put in place, the stakeholders who are you and I, the general public, the healthcare practitioners, and the government can be intentional about implementing preventive healthcare facilities. Thereby, we impress on them to provide adequate and enabling environment to ensure that we are able to prevent diseases. How do we do this? By providing things as simple as robust immunization programs, providing something like as simple as primary healthcare centers, and as much as providing proper sanitary environment. So, in earnest, if we can have a decisive action about this and be intentional about prevention, we are going to save a whole lot as individuals and also as a nation. Now, when we deploy this in our healthcare systems, we realize that we've been able to prevent deaths, unnecessary deaths, prevent diseases, live a healthy life, improve productivity, and on the long run, we'll have a better society. Thank you very much for your time. My name still remains Dr. Nzerem Justice in Meditation.